Hi, my name is Lindsay Williams, and I'm a student at Grand Canyon University, and today we're going to be discussing some of the ethical issues and research surrounding communication. Let's start by talking about some of the principles of scientific communication. Some of those principles are going to be clarity, accuracy, simplicity, and understandability. When we talk about clarity, we want the research to be clear and concise and directly to the point. Any use of descriptive information we want to be precise and not muddied up by lots of large words or run-on sentences. It will be crucial and effective communication. When we speak about accuracy, we want this to pertain to the data that is being presented as reference. Logically, any data that can be reproduced or is peer-reviewed is the best type of research to use because it's factual and evidence-based. Using language that is simple and understandable is vital because we're going to be developing teams, interprofessional teams that might be outside of our scope of practice. Additionally, this will help with anyone who's trying to aid in the information, being able to understand the information that's being disseminated. All of these principles will aid in the ethical implications in human research. When conducting research, we want any participants to voluntarily participate, have informed consent to the procedures and any observations that will take place, have complete anonymity, confidentiality, any knowledge of any risks or potential harm, and precise results of the communication that's transpired during the research project. These implications can ensure that the data deduced from the research is both ethical and that the participants' rights have been intact. If we do this correctly, this will produce unbiased information for research, which prevents any sway in the results. Ethical boards, like institutional review boards, consist of a panel of interdisciplinary professionals that formally review and monitor biomedical research, that ensure that all the rights of the participants are not violated, and that the research being conducted is relevant to the topic. If they're not being followed or any participants' rights are being violated, then that research project will be shut down. Working with research participants prepares us to work with patients and their families and other healthcare professionals. Communication is key in building these relationships in a healthcare setting. Some effective communication tips are being clear and concise, by using plain language like we spoke about earlier, preparing information ahead of time, being mindful of the body language that we're using a warm and receptive tone, actively listening by maintaining eye contact and focusing on what the individual is saying, building our emotional intelligence, and developing a strategy of how we will communicate both with these individuals, both in the present and in the future. By using these tips, we can ensure that patients, their families, and other healthcare professionals understand the information that we're sharing. Doing this well, we can build trust in those relationships, and by building trust and respecting others' needs and input, we can build confidence in our beneficence, non-maleficence, and our ability to respect the autonomy of our recipients and ensuring that justice is being enforced. Communication includes our correspondence in writing as well. Some of the keys to effective writing in a formal correspondence is knowing our audience, avoiding repeating any information, using evidence-based and factual research that can be reproduced, using proper grammar, eliminating filler words by using a clear and concise language, and thinking through and editing what we write. Additionally, having a peer go over the data that we're presenting will help us edit down some of the information that we're putting out and preparing to be concise and making sure that any data that we are presenting is well supported. In conclusion, knowing how communication is in healthcare, knowing how important communication is in healthcare is crucial because our patients' lives and development of technological and physical protocols within healthcare are at stake. We must consider how crucial it is in developing interprofessional dynamics, the treatment of our research participants, and ultimately the advancement of medicine. Thank you.